Welcome everyone to our KDE School Nurse End of the Year webinar. We have got lots of ground to cover today and want to give everyone plenty of time for questions and answers at the end. So we are going to move quickly into our content. Today, this broadcast is being archived on the KDE Media portal. It will be there for you to watch later if you have questions or if you'd like to refer any of your district administrators to the webcast, you can do so there. We have a Go Soapbox link if you want to submit questions during the training today. The access code is school nurse with no space or no capitals. We ask that you make sure that you put your full name and your district in the question box when you're asking questions, because if we run out of time or it's something that we may have to do some research on, we want to know who you are so we can get back with you in a timely manner. If you're having trouble with any of your IC stuff or any of your hardware, will need to contact your district media folks to help you get signed in. Okay. Today's agenda, we are going to talk about some smart therapy for asthma. We're lucky to have Dr. Bob Kuhn with us again from the University of Kentucky and one of his colleagues to give us a brief update. We're going to talk about Infinite Campus updates and end of the year reminders, some general school nurse updates for the end of the year. And we've had lots of questions about our legislative session, and Matt Ross is going to cover all of the school health related legislature points that went through this year. Michelle Malicote will give us an update for the Department of Public Health, and then we're going to wrap things up with questions and answers and some dates to remember for the upcoming summer and school year. Okay, I am going to turn things over right now to Dr. Kuhn at the University of Kentucky, and he can introduce his colleague. Dr.
Kuhn? Good afternoon, everyone. My name is Bob Kuhn, and I'm a pediatric pharmacist here at the Kentucky Children's Hospital, faculty member in the College of Pharmacy. I've had the privilege to address your group off and on for a number of years. I think 4 years ago was the last time in person. But first, let me say, as a healthcare professional taking care of children, thank you for taking care of our kids. I can't even imagine what you guys have been through the last 3 years between parents, staff, and just all the things you guys have had to deal with. So we're going to cover a couple of things. I have with me Dr. Paige Grube, who will be a neonatal specialist at Cincinnati Children's Hospital when she finishes residency here in a few weeks. So she's heading up across the border. But we're going to go over a couple things. I wanted to address right off the bat, Angie sent me a release about the potential release of inhaled epinephrine nasal spray, okay? You may have seen it on the news. I don't think it'll happen real soon, but just so you know, this will be the equivalent of Narcan for anaphylaxis, okay? So it's a 2 milligram dose of epinephrine. Think of your EpiPen, Junior or EpiPen. Remember, the nasal mucosa is a very rich environment for drug absorption. So just like Narcan spray or the intranasal naloxone can reverse rapidly morphine, then epinephrine will be rapidly absorbed through intranasal administration, okay? So it probably will eventually replace the EpiPen and obviously be a lot easier to give. So from a nursing perspective, it's a very safe way to give this, okay? And obviously it will have, it's going for over-the-counter status. I'm not sure that's what's going to happen, but we'll have to see. I've done a little investigation since Angie brought this to my attention, but it will revolutionize the acute anaphylactic administration, and a very safe one. Now remember, the 2 milligram dose intranasally will be equivalent to about the 0.5 or 0.6 sub-Q, okay, or intramuscularly with the auto-injector, okay? This is the Bob Kuhn speculation is when it comes out, the price of EpiPens will drop about 50% in a month, just to be competitive would be my guess. But Anyway, so from a school nursing standpoint, if you're called, I think pulling out a nasal spray of epinephrine and giving it to a child or a teenager is going to be a piece of cake compared to trying to find the EpiPen that they may or may not have. So Angie, is that sufficient for your guys' group right now for that?
Yes, that is perfect. And that's
Okay.
wonderful news.
Yeah, I think it's, and just so everybody knows, from a nursing perspective, I can't really think of much of a risk of all giving to any child who's in school. I mean, even if they have underlying cardiovascular disease. Now, this might be an issue for somebody who's extremely hypertensive and then goes into anaphylaxis, who's maybe my age, et cetera. But for children in middle school and high school kids, this is a no-brainer, okay? So, all right, so we're going to move into really something that's relatively new. Paige has done a lot of work on asthma, and she's an excellent teacher. So we're going to give you basically what we teach our students about SMART therapy, which is an innovative approach in the last couple of years to how we treat asthma. So this is the 11th commandment now of asthma to supplement the other 10 you guys have learned. So Paige has a few slides to prepare, and then I have some comments on devices, and then we'll take questions. So Paige, I'll switch chairs with you and let you start.
Thank you. And yeah, thanks for having us and letting us speak today. We'll go ahead and get started. I just wanted to start off with the most updated guidelines that we have, because that's really where SMART therapy comes in. So they do break it down by age group. So starting off with our children 6 to 11 years old, you can see, and really what I want to focus on is down in the box at the very bottom, the reliever medication. What you might be used to seeing is that we use albuterol, or that short-acting beta agonist, as a reliever. But actually what's happening is now patients, if they're on something like an inhaled corticosteroid or an ICS, and formoterol, they can actually use that medication as both their maintenance and their reliever medication. So that is really where the SMART therapy comes in, which is just single maintenance and reliever therapy using the same inhaler for both. And then we can go on to the next slide as well, which basically just shows that for adolescents that we will be using the ICS, inhaled corticosteroid, formoterol, as a reliever in this population as well. Sorry.
So just so everybody, that traditionally has gone by the trade name Symbicort, okay? Now
Yes.
It's actually a generic formulation that's come out, but that just so I know that these names sometimes are a little hard to figure out.
Yes, there's a few different ones that might fit into this category now, like as they're coming out with more, but you'd be able to recognize it by like beclomethasone. It would be the inhaled corticosteroid, or fluticasone, or things like that, followed by the formoterol. So that is something that's very new. We are trying to get away from using the albuterol alone, and we can actually go into the next slide. So this just, again, talks about the single maintenance and reliever therapy. That's where we get the term SMART therapy. And then we can go on to the next slide. And I believe these next few actually go over why we've been changing our practice. So the current knowledge on albuterol, as we've been using it for kind of those acute symptoms, we actually have found that it tends to increase the risks of exacerbations, and actually increase the risk of very severe exacerbations, especially when it's used really frequently, which it can be in some patients and some children who have a lot of symptoms. It's also been associated with increased risk of asthma-related death, a decrease in lung function, an increase in the allergic response, and an overall increase in airway inflammation, which is where those inhaled corticosteroids can come in a little bit and really target that airway inflammation. So this is the current knowledge on albuterol and why SMART therapy and changing that short-acting agent has kind of been happening. So we can go on to the next slide. So this just talks about an asthma action plan, which you might see as a school nurse. Hopefully any student or any child with asthma has one of these ready to go. It should be filled out by their healthcare professional when they're in the office. And basically what it goes through is just at points depending on their lung function, how they're breathing at that point in time, it is a good guide on what they should be doing, if they should be increasing and taking some of their short or their acute management and taking more inhalations of their acute reliever inhaler. And so this could be a good guide for you, depending on how the patient is breathing, how they're acting, kind of what steps to take next. Hopefully they should all have this on them. And then we can go on to the next slide. Awesome. So that was all that we had. I thought I had another slide in there about the benefits of inhaled corticosteroids, but I kind of already touched on them, how they help decrease inflammation. We already saw that albuterol can lead to more severe exacerbations. So using that same inhaler with the inhaled corticosteroid seems to be really helpful. Also makes it a little bit easier from an inhaler like number standpoint, and they only need one. So that can be helpful as well.
All right, so I'm going to jump in here with this device. So,
Yes.
thank you, Paige, for that. So think of this now, okay? The albuterol inhaler is an alternative and not one of the 10 commandments anymore. So think of this as a nurse or pharmacist. What does albuterol, a rapid onset beta agonist, all it does is cause bronchodilation. It does nothing to start or ameliorate the inflammatory response of asthma. And Paige alluded to it, but the studies with combination therapy, inhaled corticosteroid and long-acting beta agonists, or even short-acting beta agonists, decreases exacerbations, hospitalizations, unscheduled ER visits, missed days at school or work, and the asthma index goes up for overall. Other than that, it makes no sense. So the analogy I've used in school, and Paige has heard already, if you use albuterol, you're painting over rust. You may get some response to bronchospasm because you may be called because one of the children is short of air, or you notice that, but you might 20 minutes later be in the same boat, okay? So a question you might have is, well, Dr. Kuhn, we're using all these inhaled corticosteroids. Will these kids get oral thrush? The data shows consistently that's not the case, all right? So I wanted to review with you, hopefully we'll be able to see this. This is your traditional meter dose inhaler, okay? This is actually a Symbicort test. So this has the combination therapy, all right? And remember, as any good pediatric pharmacist, I'm going to tell you, you should use it with a spacer, unless you're part of the 5%, you can use it without a spacer. Most insurance plans will allow one every 6 months, and it should be washed like your favorite container, glass, in hot soapy water and dried out once a week and kept in a Ziploc bag if at all possible. But this is your meter dose inhaler. This would be smart therapy because it has budesonide and formoterol, okay? So remember, the beta agonists tend to be like motor oil. Albuterol, salmeterol, aldosterol, atacarol, those all in all OL, okay? And the inhaled corticosteroid. So really, this is all a patient might need, okay? Just carry around with them, okay? You can use that. Now you're going to ask, well, how many puffs can you get? Well, typically the prescription is 2 puffs as needed PRN, okay? So I want you to, if nothing else to remember, in a child who's short of air, who doesn't have a heart transplant, you really can't give them too much of this drug. Most physicians will say take 2 puffs and you can repeat a PRN. Pharmacologically, if it doesn't work in 2 minutes, you need more drug. So a lot of our action plans have 4 to 8 puffs in them, okay? Now I realize you may not always have an action plan with every child, but hopefully at least part of their care plan they do. But, so this is the workhorse, okay? Now, because this requires coordination with inhalation or a device, we're now getting a little more sophisticated. You've probably seen some of those. So now we're getting into the breath actuated devices, okay? So if you've seen a Trilogy commercial on TV in the last month, you've probably seen those, the combination of 3 drugs. This device, Ellipta, contains various ones. It's a dry powder, okay? Simply click it open, right? Put it up to your mouth, breathe in, okay? And that's really, it's breath actuated. So these are dry powders. So you keep these away from moisture, okay? Then they lock up. Many of our adolescents and middle school kids like this because it looks really cool. You put it in your backpack and everything's fine, okay? And it has a counter on it. Now this one actually is red, which means it's expired. No more, but this is my practice one. So these are dry powder, okay? One of the latest things that's come out in the last 3 or 4 years, I've seen it. This is a QVAR, okay, meter dose inhaler breath actuated device. So this is a meter dose inhaler. You don't shake it, you don't prime it, you just simply open it up. And just for clarity, Dr. Kuhn uses this because he's a dummy, all right? Simply open it up. It's breath actuated, okay? Close it, it clicks, and you got the next dose reloaded, okay? So this is one that can even use in children 6 and above, okay? As long as they can form a seal around this mouthpiece, okay? So these devices, as they're becoming easier to get, easier to use, we're seeing it more, okay? Many of our adolescents like a dry powder because it's something that they can carry around in their backpack, okay? Now, one word of caution, this is your extra credit thing, is you've probably seen Advair, okay, which is salmeterol fluticasone, one of those OLs, but we really can't use this for smart therapy. I'm sure you've all seen Advair either in this discus or the HFA, okay? Probably one of the most prescribed combination therapies we have. Because salmeterol has an onset of action of 10 minutes, this is not appropriate for smart therapy, okay? So salmeterol is not smart. That's how I have our students remember, okay? So if someone's on an Advair inhaler and they start using PRN, well, it's going to take 10 minutes for it to work versus many of the other beta agonists work in 30 to 60 seconds, okay? So really, this is not something. Now, could someone use this for maintenance therapy? You know, yes, they could. Do we use a lot of it in other areas as well? Yes, but for children now, we're talking about first kindergarten through 12th grade. I really don't see this as anything we would use for asthma unless they're going to use this and then a PRN inhaler, which makes no sense because most teenagers can't even decide which inhaler they should have, okay? All right, I hope that wasn't redundant, but those changes really occurred, as Paige pointed out, in 2022, and physicians are now starting to make that move, okay? So think of that albuterol. And as Paige said, we've actually seen more exacerbations with people sucking on the albuterol inhalers, okay? So that's something to check, okay? These devices are getting easier to use with more drug getting in the lung, and candidiasis is much less of a problem. I remember, 10 years ago, we would write 5 to 10 nystatin prescriptions a month in pediatric asthma clinic. Now we write 1 or 2 every 6 months, okay? So very infrequent, okay? So this really is helping dramatically. The other thing it does, it all cuts, for you as baby consumers, is it cuts down in the need for copays. Some of the copays, the prescription can be $60 or $75. So if you can get down to one inhaler, even Bob Kuhn's math will tell you that 75 times 1 is less than 75 times 2. And sometimes a preferred agent may not be effective. So we're working within the state Medicaid and some of the other programs to make sure that those things are available, okay? So I think that's a good kind of stopping point. We'll take any questions we have now. I know you have a busy, busy day. So we told Angie we needed 20 minutes. I think we're at 20 minutes, but we're more than happy to stay on for a few minutes right now for question and answers because we do have to run to another presentation a little bit after too. So Angie, if it's okay, if there are any questions, we'll try to take them now. And
yes, Jim is monitoring our chat box. Do we have any questions submitted at this point?
There are none at this point, Angie.
Okay.
well, I guess we were either wonderful or terrible.
You were wonderful, and you can never retire, Dr. Kuhn, because or as long as or we'll retire together. How about we can say it that way?
Well, okay, we'll talk about that, Angie, offline.
Yeah.
But the last thing I want to say is maybe just one additional word outside this thing is that my guess is many of you as school nurses have been inundated with the new different preparations for ADHD, including the latest patch, okay? We could spend an hour just on that, but know that between availability, lack of availability of Adderall and some other things, it's probably been a crazy time of this year. But really, these dosage forms are becoming more sophisticated, and really there's a niche in many cases for these drugs. Okay, and just so you all know, the reason there have been shortages of Adderall, Ritalin, et cetera, over the last few years is, as a pharmaceutical company, you just can't make as much as you can sell. You have to petition the FDA quarterly to say, we're going to make 80 kilos or whatever, and you can only make 80 kilos. And when that's all gone and it's been shown to be appropriately distributed, you can make more. So the FDA is working closely with the manufacturers, has been, to up that. All right. And finally, don't worry about the albuterol shortage for nebulizers. That's pretty much over now. And really, that's not something you probably see much of. Okay, this comes down to generic pharmaceutical companies quitting making it, so you only came down to 1 or 2 manufacturers. So I think that's gone. So again, thank you for all you do for our children in the Commonwealth, and I'll be happy to come back next year or whenever and talk again. And just for full disclosure, I married a nurse 40 years ago. I married up, and I know it. Thank you very much.
Well, thank you both. And Paige, as a former NICU nurse, you're off to do God's work. I'm telling you,
Awesome.
you'll never regret a day in the NICU for sure. But if we have questions, you can still submit them after the fact, and we'll get them to Dr. Kuhn and Paige and get your answers, and we'll get back with you. But we definitely would probably like to follow up maybe next year, school year, about the ADHD meds more, because we see more and more kids every year taking them. So we'll definitely take you up on that. I appreciate it.
Okay, well, you guys have a great day. We're going to sign off.
Thank you very much. All right, we're going to move along to our next section. We're going to have Tanya Hickman from here at KDE, and she's going to talk to you about our Infinite Campus updates and end of the year reminders. Tanya?
Tanya, you are muted.
Well, sorry about that. Again, my name is Tanya Hickman. I work in the Office of Finance and Operations and within the Division of District Support. I will be reviewing what reports are due to KDE, some updates, and provide a few helpful hints for your reports. I'm now going to turn off my camera so we can roll through the slides. But as a reminder, please go to the soapbox for questions. Thanks. This is a listing of what reports are due to KDE. We know most of our school nurses won't be in school at the end of June. Therefore, we would like these reports due to KDE by June 1st. These reports are pulled from Infinite Campus and will be posted to our student health data page. For specific data entry requirements, please review KDE data standards. We get several questions about the health office report. There is an ad hoc report located in the state published folder that will show any health office visits that you have not entered a discharge date for. We recommend that you run this report frequently so you may correct these data entry errors as you go. The path to find this report is under Ad hoc Reporting, Filter Design, State Published folder. Remember, rights have to be given to access the Ad hoc report option in Campus. Plus, Ad hoc looks at the user's overall tool rights. If there is a data element that the user does not have rights to view, the Ad hoc will not return the data. The Chronic Health Conditions Report. This is also one of our data points pulled by KDE and reported through the Student Health Data page on KDE's website. This report generates a list of students identified with one or more of the state's top 9 health conditions with condition status of not resolved in or unknown U. We recommend that you run this report and check for accuracy. This report will ensure that you are using the correct Infinite Campus codes when entering health conditions. There's an ad hoc report that you can run on this one as well, and the path is Ad hoc Reporting, Filter Design, State Published folder. Next slide, Angie. Still fairly new is Still fairly new is the Communicable Disease tab that was added just this year. This tab can only be used if the district grants access to it. This tab allows school nurses to document each time that the local health department or other medical provider is notified of a reportable communicable disease in the school. For example, we had several cases reported this year of measles. This can be used for that. This path is the path that here is shown here. This tab is not required. This tab is not a requirement to use. The school district health data refers to our nurse count report. School nurse counts should be entered before June 1st. Please note that the district point of contact is responsible for entering this information for district hired and for contract hired nurses both. District hired nurses are tracked on District Assignments tab, and contract hired nurses are tracked on the District Services Providers tab. Note, these are separate areas in Infinite Campus that school nurses don't have access to. Data checks can be done using the nurse count report located under KDE reports. Contact your district point of contact and work with them to ensure your data is correct. Next slide, Angie. Titer Immune. This is a new exemption code for immunizations in Infinite Campus. Titer Immune, which is an additional exemption option if titers are drawn instead of additional vaccine given. How to enter this information has recently been added to our data standards. The campus path is shown here. Since this is new, I'm going to walk you through it. First, you enter the date. You enter the date the certificate was signed by a local healthcare provider. If there is a waiver, enter the date of the waiver. Expiration. Enter the expiration date of the certificate submitted. If medical or religious exemption is checked, no expiration date is required. Type. Please select from the drop-down menu type of certificate provided. Is it provisional, standard, medical, or religious? Important note, if medical or religious is chosen, you must all choose medical or religious waiver in the drop-down under each immunization for which the waiver is applicable and enter the waiver date. If a titer immune certificate is presented, the waiver must be added to the immunization and a waiver date must be entered as well. As a reminder, this has to be done on each individual immunization. It can't be added as an overall exemption certificate. Okay. Open house. We get questions regarding how to find out who the KSS point of contact is for the district. A great tool to use to find that information is the district and school directory located on KDE's public website, education.ky.gov. Be sure to scroll to the bottom of the page and look for the red house icon. And thank you so much. If you have questions, please contact me or Angie. We will be glad to help in any way. We can set up a Teams meeting or visit your district. Our contacts will be shown at the end of the presentation. Also remember, you can find a lot of this information, such as how to enter the information on our webpage by searching KDE's website, education.ky.gov, student health.
Right. Thank you, Tanya. Do we have any questions on the soapbox for Tanya at this point?
We have one that has come in. We do not document our nurse office visits in Infinite Campus, but would like to be sure our data is included in state reporting numbers. Is there another way we can submit this information to you at KDE?
I'm assuming, they would be talking about submitting health office visits. And if that's the case, there's no other way other than to enter them into Infinite Campus. But if you would like us to help you get that set up where you could document in campus, just reach out to Tanya. We'll be happy to help you get that set up. If I didn't answer your question, send us another question in the soapbox so we can and we can go from there.
Nancy, can I just reiterate?
Sure.
If folks will put their name and district when you submit your question, that way we can follow up if there is need to be.
Yes. And did that person need to go back in and put their information in?
That may be helpful if we need to follow up
Okay.
with them or if
Yeah.
they would like more
If you
information.
could do that, that would be great. Okay. Is that the only one at this point?
It is.
Okay. Well, we will move along, and again, as if questions come to mind during the presentation, just put them in the soapbox with your name and district, and we'll can do our best to answer them at the end of the webcast. I'm going to give a few, just some general school nurse updates for the year as we wrap up. Just want to remind everybody that this year's medication administration training can continue through summer programming if it extends, in even past July 1st, as long as because it's a continuation of this current school year. So I know there was some questions in the past about that, but you can roll that over if you need to. Now, of course, they need to have their training updated before they start back to school in August, but all summer programming can be covered under this year. There are no changes to the training materials for this school year. So if all the exams and a training material you have is up to date, we do have we'll have an updated ELA certificate for administrators who will need that credit, and it will be available starting July 1st. You can email Tanya and she can send those certificates to you. I've submitted our application. It just takes a little time to get that back from EPSB. We're also looking for school nurse photos of school nurses in action for our website and for just KDE's communications team. Would like to have those. Any photos that you submit, just make sure that you have a photo release on file for those students at your district. We don't need a copy of it, but you can email those to myself or to Tanya, and we'll make sure that those get processed and sent. We like to brag on our school nurses, so I want to have lots of great photos of smiling kids and hardworking nurses doing what they do best. Okay. There is some new FERPA guidance that has been updated. The U.S. Department of Ed's privacy policy has issued two guidance documents to school officials to remind them of their obligations to protect student privacy under FERPA. These documents focus on student health records and encourage school officials to consider the importance of student privacy, including health privacy before you discuss student information from any education records. I have included the link here in our PowerPoint, and our PowerPoints will all be posted on our KDE website, hopefully by Monday. We have to takes a little time to get the process through, but you should have those, and you can share those new documents with your administrators. They may not be aware of them. There's no significant changes. It's basically kind of the need to know. People that need to know, and those that don't need to know. So the first document provides school officials with some general information about FERPA with a focus on their health records, and then and educational agencies and institutions, and by third parties that are acting on their behalf. The second one is more of a parent's overview to let them know their rights for FERPA on student health records as well. We got several questions submitted this time about field trips. So I'm just kind of going to give you some general information. I'm not going to read these verbatim because you will have access to the slides, but we thought it would, maybe if we talk about it a little, it will answer some of those questions. One of the big ones is, do children who require health needs or health care, can they be asked to stay back at school and not attend a field trip? And the answer is no. Federal laws mandate all students equal opportunity to participate in academic, non-academic, and extracurricular activities, which include any school-sponsored field trips, even after school hours. The school must assure that any medications that are administered are done so in a way that assures safety and compliance with school policies and procedures, and you need to follow that state's laws. If delegation is not permitted in your state that you're going to, this is always a question. Can a nurse from Kentucky go on a field trip in Tennessee or whatnot? Kentucky has different scopes of practice from state to state, and you need to make sure where you're traveling to, even the places that you're traveling through. If you're going to be driving through Tennessee, you need to know what Tennessee's laws are before on your way to Georgia, for instance. Not every state allows for delegation to unlicensed school staff. They may allow a nurse to practice there, but will not let a parent or a teacher administer medication on behalf of the school. So what are those options for those cases when you go to a state that won't allow delegation? One is if the student is old enough and responsible enough, they can self-administer the medication. It would be recommended that the staff keep the medication. The student would come to that staff member and observe them take their medication, that they took it correctly, and then document that it was administered by the student and have the student sign off, co-sign as well. A parent or family member could be allowed to go with the student. That may be the easiest thing, especially if it's diabetic care or something that's very complicated. The school district may have to let the parent ride the bus with them to go on the field trip, cover their expenses to go. But that is also an option. A school nurse could go on the field trip with the student if it's a nurse where she can practice. And then also, some districts have even chosen to, when they get to their field trip in their state, hire a contract nurse through an agency that would provide health services while they're there. On our slide, I've listed the link to look up nurse compact states, which allows you to practice nursing in another state with your Kentucky license. You can click there and see most of the states. I think there's 35 maybe that are all compact states now, and then there's more coming on in the next couple of years. Check out to your individual boards of nursing. Now, they're not always the best about getting back with you in a timely manner, but I have also listed a link to the State School Nurse Consultant webpage I'm a member of, and you can there's a map there. You can click on the state that you're going to, and it provides the contact information for that State School Nurse Consultant. You can email them and ask them what's legal in their state, and I get calls and emails all the time from nurses all over the U.S. that are coming to Kentucky on field trips. So they'd be very happy to help you answer any questions that you have. And then we have, if you've not reviewed it lately, on our KDE School Nurse Orientation webpage, we have a module on providing health services for out-of-state field trips. And I recommend you review that and check that out because there's some good information on there as well. Tennessee, we were just talking about Tennessee. They do allow for delegation to unlicensed school personnel to assist with medication administration and administer emergency rescue meds. I don't think they have always been allowed that. There's a link there to their guidance document and the Tennessee state law. And I've put the contact information I've received this from Nurse Amanda Johnson, our consultant from Tennessee. And there is her contact information if you have questions, any other questions specific to Tennessee. Okay, exams, screening, compliance, and transfers. On this slide, you'll notice there's a link to school health requirements. This is a little cheat sheet that we've made to kind of give you what's due when for school health. We have lots of different health requirements. We have our physicals, our immunizations, the dental screenings and vision screenings, and they all have different due dates. It would be nice if some point that they could decide on one date and make it all the same, but it does make it kind of complicated, kind of who's on first as to when things are due. So this is always an area of concern, and I know we have a lot of new school nurses every year, so it doesn't hurt to review that as well. Quickly, we'll talk about physicals. This is your initial entry exam, which could be preschool if it's preschool. You have preschool in your district. This can be completed up to 1 year prior to the first day of preschool or kindergarten or the first day of 6th grade. It must be on file by October 15th of the year they enrolled or enter 6th grade, and anything turned in after that date will be considered non-compliant in Infinite Campus. However, we still want you to make every effort to help those families get those needed physicals. We know kids move in past deadlines, and that's nothing to be, you're not going to be dinged or penalized for it showing non-compliant. We just want to make sure these kids have the physical exams that they need. Vision exam, it can be done at initial entry, whether it's 3, 4, 5, or 6, can be completed up to 1 year prior to the first day of enrollment, and it must be on file by January 1st of that initial entry year to be considered valid. Anything after that will show non-compliant in campus. Dental exams and screenings, it must be, this one's kind of a little tricky. It has to be done the calendar year that the child starts kindergarten. So between January 1st and December 31st of the year that they start kindergarten. So therefore, a preschooler that's in their last semester of preschool at age 4 could go on and get their dental exam early and get it out of the way, and that would still count as valid. Anything after December 31st is considered non-compliant in campus. Again, we want the kids to get it, so there's no penalty to you for them being done late. What I always did as a school nurse was when I got around to the first part of December, I would run a report to show who was missing their screenings and exams, and I would just screen those kids real quickly, pull them in my office, or if they came into my office for something else, did a quick screening and did their form and got it on file, and then you're good for the year. You can't help kids that move in after December 31st, but you'll be caught up and compliant up to that deadline. As far as screenings go, we wanted to remind you that it is up to your district to decide what grades you perform vision and hearing screens on. That's up to you. We just monitor that you have a screening program and are performing those. BMIs are not mandatory anymore. Some districts do use them, and we want to give you credit if you're doing them. So we will report it. If you put it in there, we're going to report it on our end of year exams. Transferring students. This one is a frequent question. If a student transfers from out of state in their initial entry year, all requirements are the same as any other student. They have to have immunizations, a physical, vision, and a dental. If they transfer in any other grade other than initial entry, they are only required to provide immunizations, up-to-date immunizations, and a school physical. Okay. And just want to briefly mention some upcoming training opportunities. The Kentucky School Nurse Association Summer Conference is coming up in July 5th through 7th. You noticed there was a change in the conference dates due to the Embassy Suite being sold, and they didn't save their reservation. But they're, I think, revamping the agenda and maybe had to tweak some of the speakers and whatnot. So I saw that on the listserv that the hotel rooms were available. You could book them now, and I think registration will be coming soon on the listserv. And as always, we will have our Fall District Health Coordinators Conference. This year will be at December 7th, And we may be having Dr. Kuhn come join us again. But if you watch the listserv in August, we'll have more information about the registration and agenda and anything that comes along. Let's see. Oh. Showing up. Okay. Jim, are there any questions for me or?
There is one.
Okay.
We may have to interpret this a little bit. What recourse do you recommend if they don't? So I'm not sure if they don't, what they're referring to. If you want to
What they're
respond
turning
back to that.
if they're not turning their stuff in. Get your building administrator involved. It may take a letter from the principal, or even as a home visit from the DPP staff. That a lot of times will entice them enough to come. But it's really up to your district policy what you choose to do. I've known some districts would not let students go to the prom or walk at graduation or drive their car to school or whatnot. But that all falls back to district policy. We don't want you kicking kids out of school. You're punishing a kid for something that they really don't have any control of. But just to make every effort to get it, we're not going to be the police that's going to come knock on your door and say you're in trouble because you had one kid that didn't get it. As long as you're making a conscious effort, and at a certain point, it needs, the school nurse doesn't. She has so many other things that she needs to do that you can't encompass all of your time on a handful of families. So if they haven't responded to you after a couple attempts, then it's time to move up the chain of command to somebody with a little more teeth per se, whether it's your principal or your DPP. If that did not answer your question, put it back in the chat and we will go from there. Hope that helped. All right. We are moving right along. I'm going to move things over to our legislative updates, and I'm going to turn things over to Matt Ross.
Thanks, Angie. Can everybody hear me?
I can.
I'm going to assume so. All right. Thank you. My name is Matt Ross. I'm the policy advisor in the Office of Finance and Operations. Angie asked me to sort of talk about some bills from this legislative session that just recently finished. It was a short session, a short 30-day session, which happens on off years. Next year will be a budget session, so it'll be a long session. Even so, it's a short session. There's still a lot of bills. Angie and I talked about it. We came up with a list of just 4 that we thought we'd give you a little more detail about. If there are others, please feel free to, ask about them on the soapbox, or and if I don't know the answer, then we'll do some digging and get back to you. So let's jump into it. Senate Bill 150. So Senate Bill 150 was by far the most controversial bill this session. This is the one that impacted parents' rights and around trans kids. So I've added a link to the legislative guidance that KDE has already put out. It'll take you to our website, where you'll find our general guidance on bills, but there's also a supplemental guidance document on Senate Bill 150. It may be just good to go check that out too, just to see what was out there, what we've already put guidance. It's definitely more in depth. So parts of 150 that we thought we'd draw attention to for our purposes today really goes around when you have to notify parents of sort of the provision of health services to kids. So definitely on enrollment and annually, the district must provide a list of the health services that are available to students and provide the parents with an option to refuse consent for those services. So I know that districts generally use a sort of a consent form in the beginning, where the parents would sign off. So I think that could be covered easily. This requirement could be covered easily with that document. But sort of a new twist is whenever a student is referred for health services to a school nurse, then you have to notify the parents. It doesn't have to be before the provision of services, but afterwards you have to provide notice to those parents. And then also where we also saw more, parental consent was around sort of the well-being surveys and questionnaires that are done annually. So a general parental consent is not good enough. So for each well-being survey or questionnaire that's provided to a student, you have to acquire parental consent specifically for that survey. Also, there's some requirements around the information has to be made available to parents if they want to preview those documents, and the right for a parent to opt their child out. Sort of some of the other parts of that bill talks about human sexuality and when you can discuss those things. So it impacts the grade 5 health standards. So that's going to have to change because it restricts the age with which those topics can be discussed with a child. Bathrooms and locker rooms are restricted to the gender of a student at birth. It says that you should provide for an accommodation where available. And then the part about the administration of certain drugs are prohibited when it really related to the trans kids and the drugs that they may be prescribed. So that's really all the depth I'm going to go in on Senate Bill 150. If you have additional questions, I encourage you to go out and look at that guidance document and this supplemental guidance document. And then if you have more questions, and you're welcome to ask them. And if we can't answer them, we're probably going to refer you to speak to your board attorneys, because it's definitely a controversial area. And I don't know that everything's been fleshed out totally. So, all right, House Bill 331. This one is about AEDs. So as part of that bill, each district is required to have a written cardiac emergency response plan. It's included within that emergency plan that you're already supposed to have, but they've added this written cardiac emergency response plan, and that has to include where your AEDs are. You have to provide it to all school staff, and then you have to review it annually. So Angie and I talked about the cardiac plan. I think that there are some available online if you need a sample. I think the American Heart Association may have one. I don't know. There may be another one out there too. So if you're looking for, I don't think KDE is going to come up with a cardiac emergency response plan template, but there are resources available. And that cardiac response plan has to be rehearsed at the beginning of each athletic season. So by your trainers, your school nurses, your athletic directors, and your coaches. Next slide, please. So AEDs are now required in every middle and high school building. And then when you get additional AEDs, then they would like them to be at middle and high school athletic practices and competitions. Then there are just some plans. The bill requires some formulation of plans. Who needs to be trained on them? So you have to adopt a procedure. You have 3 employees and all coaches. Athletic coaches must have CPR certification. And then you have to develop an event-specific emergency action plan for non-athletic events held off campus. Thank you. And then there's some reporting, which I don't know that we've totally fleshed out how we're going to intake that reporting. So districts will have to report to KDE the number of AEDs that they have, and then we'll have to publish that. There is a fund created, but I don't know that there was any money put into it. The fund will be in CHFS, and it's to help pay for AEDs, district AEDs, and maintenance of AEDs and training, CPR training. And then there's some requirements about that KHSAA has to adopt some rules around AEDs and emergency plans. So that's all for that one. We're going to jump now to the medical marijuana, Senate Bill 47. I think the most important thing to remember about this one is that it will not take most of it does not take effect until 2025. So I think the high points there that you may be interested in is that it prohibits patients under 18 from possessing or acquiring cannabis. So you have to basically have, a minor's guardian has to consent to the prescription, and then it has to has to control the administration of the marijuana. And then you can't, if a student is under 21, it prohibits them from having medical marijuana that's consumed by vaporization. So because the bill also prohibits the smoking of marijuana, I'm assuming then it would have to be some form of edible or some type of tincture or something. And then it requires local boards to have a policy that would permit students that are registered qualified patients to consume medicinal marijuana. So they're going to be allowed to have it at school if it's prescribed. Here's just sort of the language from the bill that says that districts must adopt a policy that allows the student to consume medicinal cannabis. And then it talks about it has to be administered by a school nurse or under the supervision of appropriate school staff. Next slide, please. So that's all the depth I was going to go into on the medical marijuana. If there are additional questions, feel free to put them in the chat. And then House Bill 538 is the student discipline bill. I think this was a reaction to some events maybe in Northern Kentucky. But if a board determines that a student has made threats that pose danger to students and staff by a clear and convincing evidence standard, then that student has to be expelled for at least 12 months. And then it also requires the districts to adopt policies that to punish students for physical assaults to students and staff off school district property. It has a statement that clarifies that a district can expel a student from longer than 12 months. I think there was some confusion about that, but I think that's always been the case. And then 30 days prior to the end of an expulsion, the district is supposed to review that and sort of look at the case and all the extenuating factors and determine whether or not that expulsion should be extended beyond however long it was. So in lieu of expulsion, so aside from the student making threats that are a danger that would trigger that 12 months expulsion, in lieu of expelling a student can be placed in an alternative program. And then it's got some information around what that alternative placement should be. You can't put a child into alternative placement without giving that student's guardian the right to have a hearing. They're still subject to compulsory attendance. They still get funding. And then that placement needs to be reviewed at least once per year. So then it has some provisions around disruptive students. So it encourages principals to establish these procedures around disruptive students. And if a student is removed 3 times from a school classroom, they're considered chronically disruptive. 3 times in 30 days from the same classroom, they're considered chronically disruptive, and they could be suspended for that without any other reason. The principal and staff are supposed to come up with sort of a action plan for that student to sort of remedy the disruptive behavior, and then they can be permanently removed from a classroom and placed in another class or alternative setting if they're chronically disruptive. And then there's an opportunity to appeal, of course. So next slide, please. It looks like that's it. I'm happy to take any questions, or we can wait to the end, whatever you want to do, Angie.
Jim, do we have anything?
We do. That's no surprise to Matt, I'm sure.
Well, let's just go right ahead.
I'll try.
So the first one is, one of our schools saw 1,988 visits in 1 month. Any advice on notifying that many parents or how to notify?
I think that may be something you'd want to discuss with your board council. The language says that you have to notify the parents on when you provide health services, and health services is defined. And Angie and I looked at that definition, and it seems to be most of the stuff that a school nurse probably does. So is it possible that aside from an email, a call, or a note back to that parent, is there anything else you could do? I'm not sure. You may talk to your board council and see if they believe that you could put some type of information in your general release form that would waive that, alleviate that requirement. I don't know. I mean, I'm just telling you what the language of the bill says, and that is, on the provision of health services, then you need to notify the parents. And I get that it's going to be more onerous from some districts than others. So I really don't have any good guidance or suggestions, but I can just tell you what the law says.
Next question. When athletic simulations are over the summer and nurses are not in, can the district nurse take the place rather than the school-specific nurse?
I would think that, obviously the intent is probably for the person that would be involved to rehearse that. But it may be possible. You might want to talk to your board attorney, your local council, to see if he or she feels like that complies with the letter of the law.
That's the only 2 questions that have shown up at this point.
Thank you. I will say most school nurses do have a few extended days, not many usually, maybe for opening day, closing day type thing above when students are there, that possibly you could work out something that you could use that as one of your extended days. You'd have to work that out with your district health coordinator and your superintendent and whatnot. But that could possibly be an option, that they get credit for a work day for the school year. Thank you, Matt. And
You're welcome.
here's Matt's email, and so you can always email myself if there's more questions that come to mind later on. And I am going to just keep moving right along because everybody's time is valuable, and we're going to move into our public health updates, and I'm going to turn things over to Michelle Malacote.
Hey, good afternoon, everybody. And I know some of you thought that the meeting was over at 2:30, and so we had planned to 3, but I'm sure not going to take that long. So I've just got a great, wonderful announcement for you all today, and I'm just going to go through this very quickly, and I think you're going to be excited to hear. So, all right, we'll move to the next slide. So the immunization branch and the school health branch have joined efforts, and we have developed a back-to-school outreach immunization toolkit for you all to use. Okay, it's really exciting. It includes a lot of resources such as shareable social media graphics and flyers. We have redone the immunization requirements for Kentucky schools, and it's got a lot of resources and all kinds of things that you can use, and I'll go through those real quick. So, by the way, this toolkit is on the immunization outreach webpage on the right-hand side, and the click is Back to School Toolkit. So, all right. This one is one of the flyers for kindergarten. As you can see, is your child kindergarten ready? Contact your healthcare provider for the back to school physical and get up to date on immunizations. And then it just shows what immunizations, and there is a QR code that will show the schedule actually. All right, next slide. The next one is for middle school. Also, get ready for the new school year and get the vaccinations and the physical and the yearly checkup that your child needs. And it also has a QR code included. And if you'll notice, the Kentucky Public Health logo on the form has school health underneath it. I'm so excited. All right, next slide. The next one is for high school, and this is for the 16-year-olds. It just says, is your child in high school? Make sure they're up to date. Your child needs a booster at age 16 and back to school, high school, age 16. So we did also think about the possibility of maybe putting this flyer with the paperwork that the 16-year-old comes up to the front office to get their driver's license. So yeah, that would be maybe a way to get it to them. So, all right, next slide. The next one, some of you old timers may be familiar with this reference, but we've revamped it, and from my friends from the immunization branch, Crystal Back, she helped me update this, and we have an all new version of this. So this version is, of course, for childcare up to preschool, and we did extend it up to age 5. It's also got some of the QR codes for exceptions and the actual ACIP guidance. All right, the next one then. The next one is for the school age child. We just did 3, 4, 5, 11, and to 12 and age 16. It's a different color, but it's got all of the new recommendations on there as well. Okay, next slide. This next one is the quick guide to Kentucky immunizations requirements. If you want to just look at it in a glance, if the parents are in your office and you want to show them an easy way in just verb or in word format of what they need, and that's what this is for. We've also separated this one in those same categories as well. Okay, next slide. So the next slide, I'm just going to zip through these. This is just the packet of what is included in the toolkit. You'll see the regulations that I've included, the ones that are legitimate ones to refer to for immunizations. It's got all of the certificates, and the summary requirements are also on this handout as well. It's got the CDC resources that you might use often. I have also included a document that lists the trade names of the vaccines in case that's the way that you get the report from the doctor's office. You can actually convert those vaccine data into the actual components of the vaccine. All right, next slide. And then what I've done is I've taken all of the regs there and I've given you a little mini summary underneath there and what's important in the middle or in the midst of all of those regulations, what is most important for us to be looking at. So it's a summary guide. So that's there. All right. Next slide, please. This is a couple of other things that are included in the packet. There are some sample call scripts if you're going to do some telephone calls or reminders to families or to of kids that need any of their immunization or their health components. We have also given you a back to school immunization outreach helpful tips sheet on times you can outreach, activities you can do, and just give you some ideas on when you can outreach. In Madison County, we put flyers in the 5th graders' last report card envelope. So that's how we did that whenever I was in Madison. So, all right, next slide. And then the next, this next document is a notice of incomplete health requirements. And I've just made this a standard form, and it's also available. It's just a sample. You do not have to use it. It does not have any of the Kentucky Department for Public Health logo or anything like that, but it's just to give you a sample or a starting place if you want to just send a reminder. It also includes certificates and physicals, eye exam, and the dental screening as well if you'd like to use it. So, okay, next slide. And then the very last slide, I want to remind you all that the HEPA air filtration units are still available. There are still 65 school districts out of 181 that have not ordered their free $3,400 air filtration unit. So if you are interested in doing that, or you've got any questions about that, we have included the outreach form, and you and the superintendents have been hearing about that for several months. So I just want you to know that That project is winding down, and I believe that the end of tomorrow is the last day for ordering those. So, all right. And then the last slide is, if you have any questions, put it in the Go Soapbox app, and we will not answer it in lifetime because I think we are running out of time, but we will be glad to follow up in an email. So please go to the KDPH Immunization Outreach branch, look for the toolkit and everything you're going to need to outreach to the students during testing when hopefully the volume of the student visits are at a minimum, and you're going to have time to be able to do that. So thank you from Candace, Beth, and I, and good luck. And I believe there's only 19 or so more days of school left. So wishing you great luck, and thank you all very much.
Thank you, Michelle. Jim, do we have any questions for Michelle while she's still on?
We do not. So,
Okay.
Michelle, you're off the hook.
All right. Thank you all. I appreciate it.
Okay.
And you're going to love it. Go look at it. Thank you.
All right. Any other questions come floating in before we wrap things up?
There was a follow-up comment following the question around if a district nurse could take the place of a school nurse during the summer events. And the comment was, school nurses aren't at athletic events anyway.
Matt, are you on there? Still on with us?
Yeah, I'm still here. And I don't know that it requires them to be at the athletic event. I mean, I just know what the language of the bill says about the rehearsal, and I'm not sure, what the intent is there, other than they are aware and walk through it with the other folks. I mean, I think KHSAA already has some regulations on that, and I think they're probably going to do some more. So you may wait and see what they come out with, because that generally dictates, the things around athletic events.
But I would still think, though, the law requires their oversight and
right
responsibility for that training and rehearsal. So I can't see, even if the nurse isn't present at the ball games, that would get them out of not having to rehearse.
Absolutely right. I believe that they have to be a part of that rehearsal for sure. Yes.
Yeah, because they're considered a content expert basically for your school. So, yeah,
that's right.
I think you're going to need to be a little creative on maybe when people start to work back, they may just have to give them an extended day or whatnot on their contract. But I don't think we can get around that one, just like we can't get around notifying the parents
That's
either. Right. Okay.
I mean, and the statute just says that a nurse has to be present. So I mean, if the district nurse could do it, I think that would be all right too. I mean, it doesn't specify that it has to be what nurse, but I mean, I think the intent there was if somebody was going to be involved, but you may be right. It just may be that you need a nurse to oversee that whole training process too.
Yeah. And, the plans have always, I think, kind of been in place. Our athletic directors and stuff have kind of focused on that more so. They've just added the school nurse into the big picture, which is good, because we want to be at the table when these decisions are being made. So, yes, it's more work, but I think it's still a good thing. All right, Jim, nothing else?
No, we are in the open.
Okay. All right. Well, we are going to wrap things up. I know this was kind of a whirlwind and everybody went really fast and there was a lot of stuff thrown at you and you're going to need some time to process it and digest it. That's the wonderful thing about the KDE Media Portal, is you can go back tomorrow or next week and whenever and watch it again. And you can also send that link to your administrators. We'll definitely get our handouts and PowerPoints posted on our webpage, hopefully by next week. and that way you can have all that as well. Feel free to reach out to myself, Tanya, or any of us if you have questions on any of the areas that we have talked about today or something that's come up. And we can see the finish line. We're just getting there. It's slow, but we've almost made it to the end, and you've almost made it to the end. And I want to thank you all very much for what all you do on a daily basis of taking care of these kids and loving these kids and giving them the best educational experience possible. And you'll get your reward one day for this, so that's for sure. So I hope everyone can have a good summer, and we will hopefully see people at KSNA, or if not, at the district health coordinator meeting in the fall. So thank you and have a wonderful day.